information is power, and if you know why you're taking it, people tend to be more adherent and to take it the way that they need to take it. So definitely you need to first and foremost know why you're even taking the medication at all. And there's generally two names. We say the generic and the brand name. The generic is generally that really big name that you can't figure out how to pronounce, and we'll always help you with that. It's nice to use at parties if you know how to say that word. And then you have the trade name, which is just a little easier, something that you can know and say. Like for instance, when I think of even an over-the-counter medication, you have Motrin, which we all know, but the generic name is ibuprofen. You need to know, do you take one tablet in the morning and one tablet at night? Do you take 2 tablets at one time? So how you correctly administer the medication is something that's super important. I've seen a lot of patients who are disappointed because they think, oh, it's going to work immediately like my Motrin does, but it doesn't. It's going to take several weeks before it begins to work and before you get to feeling better. So you definitely need to make sure to know what to expect. Sometimes our generics change. So a different company might make a different generic for the same drug. It'll work just as well, but it'll look a little differently. So always know how your medications look. And if you see that it looks very different from what you received the last time, always ask your pharmacist about that, because one, we could have dispensed the wrong thing, or the generic could have changed. It really depends on the medication, but generally what you can do is take it as soon as you remember, if it's close to the next dose, to skip it and then go ahead and take your next dose. But always just call your pharmacist. We're there and we'll easily answer that question, because we'll look and see, is this drug a little different, and there's some other information we need to give you. Probably one of the biggest misconceptions as far as medication is concerned is that you store your medications in your bathroom in what we call the medication cabinet. And that's probably one of the worst places you can store it, because you need to keep your medications in a cool, dry place. So if we think about the bathroom, you have steam from your shower, you have all these things that are going on, and when they're not stored in that cool, dry place, they'll break down and they'll not work as well as they should. Probably the worst thing you could do as a patient, and I really believe that knowledge is power, but it's to go and to look it up on Google and look at every adverse effect or side effect that may occur, because there are so many you cannot imagine. And so I've seen people, and I've seen their eyes, they slowly kind of blink and get sadder and sadder and more horrified when they start looking at the 100 possible side effects that can occur. But if you look at the likelihood, it's like less than 0.05%. So is it going to happen to you? Probably not, unless you're the luckiest or maybe unluckiest person in the world. So, always ask your pharmacist so we can lead you into the direction of the ones that are more likely to occur. You need to always not only know what the allergy is, but what happens. Okay, so you said you have an allergy to penicillin, but what happens? Do you just get a rash? And I'm not saying a rash it's minuscule, but there's a big difference between you having a rash and we can put a little diphenhydramine on it versus you can't breathe and we need to take you to the emergency department. So, you need to know what that reaction is, when it occurred. And I know a lot of people think that they have an allergy that's not really a true allergy. So what you described, yes, that's an allergy. A rash, that's an allergy, versus if I take certain medications, it makes me nauseous. That's what we call an intolerance, and there is a difference from that. An interaction simply means that you have medications that when you take them together, they can either make the medication work way better than it needs to. So let's say you're taking a blood pressure medicine, because your blood pressure's been high. Of course, if that medication begins to work way better than it needs to, you're all of a sudden falling on the floor because your blood pressure has gotten too low. Or they can make the medication not work well at all. We always look at that to make sure that there aren't any interactions, and there are times where we know there's an interaction, but we adjust your other medications accordingly. So there might be a medication you just really need to take, and so we'll adjust the other one. Maybe we'll lower it or we'll increase it to make sure that we take care of that interaction.